Okay, so welcome everyone to our second webinar on growing resilience. This time we're focusing on growing resilience as a community. Our first webinar focused on growing resilience as an individual. And it is a pleasure to be here with you all from all across the state. We at Cornell Cooperative Extension in Delaware County and Orange County have linked forces, so to speak. We're building our own community here to provide resources for our colleagues and partners and our communities across the state, really to talk about how we can grow resilience in this very different time. And many of us had some small initiatives going already before the pandemic and have been working for a few years, some of us, on initiatives that really bring about resilient communities. And now this undertaking is just as important as ever. So we're delighted to be here with you, and I just want to go over some very quick Zoom etiquette. If you would like to, turn your video on to say hello, and give some shakes, that would be awesome. And yeah, it's great to see you all. Oh, look at that, all these wonderful people from all across the state. Woohoo! That is great. So thank you so much. During the presentation, we would like to invite you to turn your videos off again. It's great to see you, but then be able to save on the bandwidth for those of you all who may not have a stable internet connection. And we will turn the videos back on later. But this way we can be sure that everyone has the best video and sound quality to listen to the beginning of it. So we are going to start by sharing with you briefly about the hydration challenge that we introduced at our last meeting. And then we will move into our panel discussion for today. And then there will be some time for you to also go into breakout rooms again, to have conversation with one another, and then we'll come back and share and hear. And then of course we're going to leave you with yet another challenge, and we will tell you about some of the upcoming events. So for now, I would love to give it to my colleague, Megan Young, to hand her over. And she is going to tell you about the results of the hydration challenge. So Megan, you here?
Yes, I am. Hello, everyone. Good afternoon. Thanks for joining us again. We're so happy to be here. Just briefly, so I'm going to put up a poll before I get into the fun recap of the hydration challenge. So real quick, after the last workshop, we talked about physical resilience and self-care and taking care of ourselves to keep us in our resilient zone. What can we do to keep us there? And so we are introducing these challenges to help maybe jumpstart a new habit, or just act as a reminder, whatever it may be, just to help motivate us to keep ourselves going and taking care of ourselves in these times. So we introduced the hydration challenge. It was a 2-day challenge. We hopefully, if you participated, you got the materials, you learned some ways to keep your body hydrated. Our body is a machine, so it's important we nourish it and take care of it and cherish it. And water and staying hydrated can do so much for us. So we sent materials to educate on, what your body needs, and then we put it into action. And so quickly, I'm going to put up a poll. We're just trying to get some feedback about those of you who might have participated. Hopefully that's a lot of you who are on here today as well. So I'm going to launch a poll and give you a few minutes to answer a couple quick questions. It should be coming up. Yulika, you can see it, correct?
Yes, we can see it. And here we have it launched. First question.
There we go. I see results coming in. Awesome. Still coming in. Give it a few more seconds here. All right. So this is awesome. So this is just so we can have an idea and continue to offer what works for people. And so I'm seeing, I'm going to end the polling. This might be my first time successfully doing this, by the way. So this is great. Thank you for all who answered. Probably a little split on, looks like we probably have some new people joining us today and some returning from our last workshop, which is fantastic. We had people participate. Many found it motivating. Many learned some new information, exactly what we were hoping for. So thanks for answering that. And Yulika, you can move the slide forward.
Okay, great.
So we had about, our guess was we had about half of our participants who were on our the last Growing Resilience workshop participate. And we just put together a big collage of pictures and photos that were sent to us. And I'm really happy to share so many of you who participated took the time to not only send us photos, but write out some really awesome plans about how you're going to keep yourself hydrated through the day of the challenge. And that was just really awesome to see that everyone took so much time and effort into it, which was, you know, it helps us know that it was an important topic for people. So this is one of the slides. We have 2 more slides with photos and plans. You can just go through them. We even had some reminders of keeping our furry animals, our furry friends hydrated as well. So we had all members of the family participating from some people, which was awesome. And in addition to the photos we got and the plans we got, some people also sent some really nice antidotes in the emails, as well as what a great reminder this was for them. So this really seemed to hit home with those of you who participated. So it was just thrilling to see, and you are all awesome. And even if maybe you didn't participate, but you got the information, you can do it anytime. That's the wonderful thing about this. The material is there. If you're interested in the material and you weren't part of our last workshop, you can email us and I will happily send you the resources so that, you know, you can do this on your own if you like, with your family maybe. So you're all awesome, and these are great little things we can do at any point just to keep taking care of ourselves. So that's a recap on the hydration challenge. We have another awesome challenge coming for you after this workshop, but you'll have to stay tuned to hear more about that. So I'll turn it back to you, Yulika.
Yeah, so much for a snippet to keep you on. So thank you very much, Megan. I would love to now introduce our first panelist, Deanna Cruteau from Livingston County. After that, we also will hear from Ginny Darling in Delaware County, and we will hear from Daniela Jackson in Westchester, and from Dr. Maxine Reddy, who I believe is also in Westchester located, but in a national organization. So thank you all for joining us. And I will start by asking to just share, we have here a few more slides for Anna to share with us a little bit about her initiative in Livingston County.
You all done, honey?
Okay, so I'm going to start by saying that I am just the spokesperson for this. I am definitely not this is not my initiative. This is a team approach. So in Livingston County, we've been working on this topic. And I would say that we're looking at kind of holistically trauma informed, and then building resilience. So we've been working on it for about 4 years. It really does take time to do this. We started with a very small, 3 of us working on an ACEs work group, and then it grew up and it kind of melded and recombined groups from the ACEs work group to Trauma Informed Communities Committee, which is the current entity that we work under. And we're under this umbrella organization that's funded through Office of Rural Health called Genesee Valley Health Partnership. And there's some little bullets down there that you can see. In 2018, we contracted with the University of Buffalo's Institute on Trauma and Trauma-Informed Care, which is under their School of Social Work,
I
to
can't hear when this thing's going.
training for a bunch of us, a couple dozen.
Yeah.
So if you can flip to the next slide, because I know that we're going quickly. So this, I had a fun time building this slide because I wanted to show all the different agencies and entities that sent a trauma champion to this training. And as you can see there, well, they're kind of cut off at the bottom, at least on mine it is. But tons of people. Matter of fact, Hillside, one of the trauma champions, is actually on this call. Ford Best is on here among the many, many people that are on this call. So the idea was that to promote trauma awareness and healing from trauma and building resilience, that we need to become champions. We need to become experts ourselves and have those experts embedded in all these key agencies and organizations in our community who can then turn around and train their organizations. And that way they can be our champions of change. So we were ready. It took us almost a year and a half to do the training. You can see that it's actually 24 champions were trained, 20 different organizations. If you look at it, it's about 4 full days of training spread out over actually a little bit more than 12 months. We were all ready to do a big rollout with CEOs and county supervisors and everything. And guess what hit? COVID, yeah. So boom, came to a screeching halt. So when life gives you lemons, you deal with it, right? So I sat down with a couple other key members, and we, you can flip the slide, we did some work, some groundwork. So one of the things that we wanted to do was give them a framework for training in their organizations. So we created these 5 2-hour modules of training. So it's about 10 hours of training total on solution-focused, trauma-informed change. And it's based around, changing your whole organization's way of thinking and doing business so that we are not re-triggering people or re-traumatizing people. And instead we are promoting healing and resilience. So we created those because we were all locked down and, couldn't reach out to people that much. Since then, we've also contracted to bring Seeking Safety. I don't know if anybody is familiar with that. It is a program to help people heal from PTSD or trauma and substance abuse. We trained about 60 individuals. We also did about 50 manuals. These were all through a grant that we received. We also created some online caches of information that agencies and schools could use to promote, mindfulness and different resiliency techniques within their schools and agencies. So we use Google Classroom, Google Share. We also have this teen health series that's going to roll out starting in January with various topics like peer pressure, conflict resolution, coping strategies, healthy relationships. One thing I forgot to put on the slide was also we contracted to train 5 school districts in mindful schools. And we also are using some different techniques within schools, different programs such as Mind Up, Zones of Regulation, and the Second Step program to promote healing and resiliency in our community. So that's kind of what's going on at Livingston County. And this is a huge undertaking with many, many people, as you can see, involved.
Yeah. Thank you so much for that overview, and we will come back and have some questions as well. I would love to turn it over to Ginny Darling, the Executive Director at the Cornell Cooperative Extension in Delaware County. Ginny, are you here?
I am, and welcome everyone. It's great to be here with you today. We've done some of very similar work in Delaware County as Livingston County has done. We got inspired with working on resiliency and ACEs work when we were putting together a 5-year competitive grant for our Rural Health Network in Delaware County. We're the lead agency for Delaware County Rural Healthcare Alliance. We have many partners, just like they do in Livingston County, and a lot of wonderful, great ideas. We did focus group work and really connected to schools, healthcare partners, as well as community and agencies to really decide what we really wanted to focus on. And we decided for our grant application that we wanted to create a collaborative way of educating our organizations to learn about ACEs, adverse childhood experiences, science, and to implement trauma-informed and resilience-building practices and policies. We have, our first step was to establish an ACEs task force in Delaware County. And we are using that group to really inform us to really what we want to accomplish. We've been working on this for probably about 1.5 years. And the next slide will share some of the things that we've done similar to Livingston County. So we worked with, again, SUNY Buffalo to do a champion collaborative training. We actually presented it to our policy council for our Delaware County Rural Healthcare Alliance, as well as our ACEs task force. And they wanted us to really train leaders, organizational leaders in schools, agencies, and healthcare. And so we actually developed a course. We started the course last March with an in-person meeting before COVID hit. And we had designed actually the course to meet virtually monthly. So, you know, it really worked out well for us that we had made that decision to go virtual before we even knew we were going to have a pandemic. And so because we had everything set up, we had people, I think it was 29 organizational leaders that were actually going through monthly basically consults and training with the School of SUNY Buffalo School of Social Work in the spring. And we actually finished, we were supposed to have a face-to-face meeting in June, but we ended up doing a virtual training to finish the course. It was very in-depth. It helped people that were in leadership roles like superintendent of schools, principals of schools, or you know, executive director of agencies, and people in healthcare to really look at their own organization and really make policy changes. We also changed the training so that people could really kind of react to what was happening to them with the pandemic. So it was really very helpful to a lot of people that were going through very stressful times to figure out what they could do to help people in their agencies with trauma-informed practices. While we were going through the training, we also did a survey. We started working on surveying training needs of our community. And I'll show you a slide of that, but we're still working on that to really identify what we want to do. We found, this is just one of the slides from the survey, that we have a lot of people that said yes. 46.5% of our 86 responses were interested in more training, and 39.5 maybe. So we have a number of people that really need training. 35% had not had any training about ACEs, and there wasn't an awareness of our ACEs Champion Collaborative training. So we are moving ahead in our county to not only be part of the growing resilience training that we're offering this fall, but also training for 2021. So I'll be sharing that opportunity for people to come back together, continue to be trained in resilience techniques as we identify other training needs that we want to offer in our county. So it's been an exciting time for us, and we welcome any of your suggestions and ideas as we work on how we can train people in the future across the state, not only in cooperative extension, but with all of our collaborators, to really actually be more trauma informed and really practice being trauma informed, as well as build resiliencies in our community. So that's what we've done in Delaware, and we look forward to your suggestions and ideas how we can work together to continue this work.
Thank you so much, Ginny. So we have now heard from 2 initiatives that are related to Cornell Cooperative Extension, and I am now excited to introduce to you Daniela Jackson, who is the Chief of Planning and Research and Staff Development at the Westchester County Department of Probation. Daniela, are you here?
I am. Good afternoon, everyone. So for Westchester Probation, we were in the midst of showing the resilience film to our department in an attempt to becoming a more trauma-aware, trauma-informed department. And at the same time, the Commissioner Rocco Posey is the lead contact. Our department is the lead contact for the Mid-Hudson Regional Youth Justice Team, which, as you see, is comprised of 7 counties. And we were awarded some funds from the state, from the governor, from the state, through DCJS for the team to look at some ways of changing juvenile behaviors and juvenile partners that come in contact with juveniles in the criminal justice system. And so one of the things that we thought we would look at was showing the resilience film, which is something that had been happening here in Westchester. So there were sort of 2 things happening at the same time. And I had an idea here in our department, and we were running with it. And then over here on the other side, wonderful partners in Westchester County, Dr. Andrew Bell of our Department of Community Mental Health, Elena Falcone of Westchester Library Systems, who has really been the hub of the Resilience Coalition of Westchester, and then Janet Donette of Family Services of Westchester, who also spearheaded getting screenings of the film out there. We were trying to bring sort of it all together and share it over with the Mid-Hudson Regional Youth Justice Team so that each county could create their own resilience team. And so with our funds, so we too got sidelined like everyone else with COVID. And so it sort of put us on pause a little bit. We've had our department has had a very involved response, and we've had a lot of contacts and whatnot. So we've been a little delayed, but we are trying to gear up back up again so that we can administer the ARTIC, which is a survey to measure staff's attitudes about trauma-informed care. We are looking to do now virtual trainings to train the trainer for youth mental health first aid. And we want to help each of these counties develop their resilience coalitions. So Dr. Andrew Bell and myself, we went around to each of the counties to sort of find who the cheerleaders were in each county. And that's how we found Yulika. We were so excited at Orange County. So that's how we got connected. And so that's where we are with Westchester at the moment. And then I highlighted for you at the bottom of our slide here, the Westchester Resilience website that's hosted through the Westchester Libraries website, so that you can find out more information about Westchester Resilience Coalition.
Thank you so much, Daniela. And I believe that link is a hyperlink, so you might be able to click it. Otherwise, we will make sure we'll put it in the chat in a moment. So now I would love to turn it to Dr. Maxine Reddy, who is the director at the Sanctuary Institute in New York, and who is going to share with us about the Sanctuary Institute.
Hi, everybody. Thank you so much. This is so exciting. I see a few names and faces that I recognize. We are located, Andrus is located in Westchester County, but like many of you, I'm here with you from my home in Putnam County. So this is exciting to see the group here. So as Yulika mentioned, I'm here representing the Sanctuary Institute and specifically the Sanctuary Model. And really the model is, and so this is a little bit different perspective from what's been shared already, as this is an actual, this is the model or a model that communities and organizations can actually use to implement trauma-informed and trauma-responsive care. And the model is really based on the work of Dr. Sandra Bloom, and it really thinking about the research and knowing that 60% of adults have experienced adversity as a child, and that the exposure to that adversity, and within the sanctuary model, we talk about trauma, chronic stress, and adversity sort of interchangeably. So I may say a different word, but in the model, we look at this notion of trauma has, impacted all human beings in some way, shape, or form to some degree. And really understanding that the impact of that adversity on brain development, mental and behavioral health, as well as physical well-being. And then thinking about organizations and communities that provide services to those who have experienced the adversity, and they can either advance or reduce the effects of the exposure. And so the sanctuary model is really, the focus is really to think about how do we help people create that resilience. And we do that through a shared language, so that people who use our services, regardless of where in the community they may be going, there's a shared language, and they know and understand the vernacular, regardless of where they go. If you think about your own disciplines, right, we all have our own languages that we use, school personnel, medical personnel, mental health personnel, and it can become really challenging. So the sanctuary model provides a shared language so that everybody is talking in the same way. We also have a set of practices, daily practices that people can expect and use as they move throughout systems of care. And then there's also a set of values that everyone aspires to. And the way the model works, briefly, because I know we're short on time, really starts with assessing. So really looking at what are the needs of the community? What are the needs of the individual organizations and agencies within that community? And then once we assess those needs and share back through that lens of sanctuary, everybody goes through training. So whether it doesn't matter what somebody's role in an organization is, but the intention is every single member of an organization and of the community of organizations will receive training. And then the next step is really around implementation. So I think a lot of times when you go to training, you learn something, but that's sometimes where it ends. So with Sanctuary, we have the opportunity now to have a guided implementation. And it's really a blueprint to help organizations and communities work through activities and tasks to create trauma-informed and trauma-responsive agencies. And just a couple of final thoughts. Sanctuary can enhance communities and community functioning by developing greater aptitude of providers, but not only the providers, also the recipients of the services to understand, manage, and mitigate the effects of adversity and trauma. Sanctuary model helps to build capacity within organizations and communities to better serve clients and carry out missions. And one final thought is that, really implementing the sanctuary model helps organizations and communities respond to the demands, which I'm sure we're all aware of, competing demands of increased expectations and oftentimes fewer resources, with the need to be flexible and creative within time constraints. So that was sort of the big overview picture, but hopefully it's piqued some interest, and I'd be happy at whatever point to answer any questions.
Yeah, wonderful. Thank you so much to our panelists. I would now like to ask you some questions, and I'm just going to take the slides off so that we can see you all who are talking. So I would love to ask Ginny this first question. What inspired you to initiate this community collaboration, and what were some of the first steps that you took?
So for us, I think it was working with other community members and identifying the real needs that were happening in our county, the need to really work on some of the mental health issues, and looking at a 5-year plan of what we could do to do that, and getting people together. So I think having an ACEs task force has inspired us to put together a plan every year. And I think training is something that, you know, is bringing us together to look at what we potentially could do to help families and organizations really become more trauma informed.
Yeah, thank you so much. What was that inspiration for your initiative, Daniela? You mentioned that in Westchester you had seen the film Resilience, and I know we talked about this similar to what took place in Orange County. That was kind of a culprit or a point of inspiration. How did that work? What were some of the first steps that you took to really say we're building this initiative?
The first step was listening to my mother. She had sent me an email. She's a clinician for a mental health agency here, Family Services of Westchester. And she said, I know you're busy, but I really think you should make time for this, to watch this film, go to a screening. So, you know, mother asks you to do something, you do it. And I sort of, I don't want to say I rolled my eyes, but I sort of rolled my eyes and, you know, put it on the calendar, and I went with not even really reading the flyer. My mother told me to do something, so I did it. And I sat in the film completely blown away. And then we have in Westchester, we always show the film and we do a post-film discussion, I'm sure, like everyone. And I came back to my department with my purse still on my arm and my keys still in my hand. And I walked into my commissioner's office and I said, you have to see this film. We have to do this for our department. And we actually wound up being able to show it. We do a judicial dinner every other year in pre-COVID times. And a couple of months later that year was the upcoming judicial dinner. It's a dinner just for the judges of Westchester County. And I said, why don't we show it to the judges? You know, judges don't usually like to come to meetings and things because it's hard for them to speak, but they will speak candidly in their own, amongst their own. And so we did this dinner, we showed the film, Dr. Andrew Bell led the post-film discussion. We were able to actually have them anonymously enter in what their ACE score was and really have this conversation about what their own ACE score was, what the score was of the room, about 150 people in attendance. And from there, we kicked it off and we were showing it to the rest of the department. And then, as I said, then I said, oh, you know what? Why don't we do this with the Mid-Hudson Regional Youth Justice Team? And that's how, you know, we connected with all the other counties to find out, you know, Orange County is so far ahead of everybody else. And then you've got some counties who saw the film and they want to get the film, and how do they form a coalition, and how do they get other clinicians, and how do they get other schools, and so on and so forth involved? How can we get this conversation going about ACEs, about trauma, about being aware? So that's sort of how it started for us here in Westchester. For me, mind you, it was already happening. You know, I just happened to go to a screening because I paid attention to my mother.
Yeah. Yes, always listen to your mother. I love that. Thank you. That's, I think, yeah, very inspiring. Wonderful. Deanna, how about Livingston County? What was the culprit that sort of led to that? And what was the first step that you took before you started on this initiative with, you know, the University of Buffalo?
So, you know, I had really just started with Cornell, and my boss said, go to all these different committee meetings. And there was a committee called Healthy Communities That Care that was under CASA, the Council for Alcohol and Substance Abuse. And the prevention director, whose name is Rachel Penna, she showed the Resilience movie. And a couple of us immediately were like, oh, we're going to make a work group. And, you know, that's kind of where it went to. But Livingston County has, GVHB has been an umbrella to bring together all of these different organizations and agencies, representatives to promote collaboration and fund initiatives. So we already had a collaborative structure that's been around for quite some time. So, you know, once you bite into something that is like, wow, this is really relevant, this crosses all boundaries, you know, probation should know about this, you know, the school should know about this, everything, it just flowed. That's our county's story, basically.
Yeah, thank you. This is very helpful. So yeah, so Resilience, the film Resilience has definitely been a phenomenal resource for so many of us in this. So I would love to ask, Ginny, you had mentioned already kind of where things are now, and you know, we talked about where you hope things will go in the coming year. Can you tell us a little bit more about what's sort of the vision for the initiative in Delaware County?
So our vision, I think, is to, again, look very closely at the survey, work as a team with our ACEs task force, and to identify next steps, really kind of meeting the needs of all of our partners in the county. We definitely have a high priority on training. We feel we have to continue the training, and that's why we're going to be offering training every month in 2021, January through May. We hope others will join us and continue working together. We actually have contacted, I would say, an organization in Virginia, another state, to learn what they're doing, not only you know, in the rural areas, but in the urban areas in Virginia. And maybe we can learn from what's happening around the country. So, you know, we're excited that we'll continue to learn, continue to work together, and we may actually identify some other programs that other people are doing that we could also offer in our county.
Yeah, thank you. That's wonderful. It really is inspiring in some sense to see how through this, you know, boom in the online world, we have been able to connect in ways that, you know, we haven't really before. So seeing these networks form is really wonderful, and being able to learn from one another is really inspiring. So I'm wondering, Maxine, would you able to tell us a little bit about some of the community efforts that you have seen specifically around communities that have actually been able to implement sanctuary?
Yeah, I'd be happy to. It's really amazing when a community comes together, but it starts with, I think, efforts like what we're hearing about today. I'm just so impressed by everything I've heard, and that's really the foundation that needs to be laid, I think, in order for communities to really take the steps necessary to be there to really take care of each other. That was really the vision of Dr. Bloom, was you know, this community of communities to be there to help each other and to heal each other. So what I've seen in my time at the Institute and in terms of the sanctuary model, there are communities around the country that have gone into implementation as a community-wide effort. So the courts, the hospital, the school district, the mental health providers, juvenile justice, the police departments, drop-in centers, shelters, street outreach programs, after-school programming. And what they've committed to do is, at their own individual organizations, to undergo that assessment that I talked about, as well as the training. And then we bring everyone together. We have teams of people that sort of work together across, I don't want to say across systems, but across agencies, so that they are working together on the implementation. And they really have created, through following particularly sanctuary, and I'm sure that there are many other ways to do this as well, but through implementation of sanctuary to really create a trauma-informed and responsive opportunity. You know, one of the things that we know is that as teams work better together, the outcomes of the clients increase. And so that's really one of the main focuses, is to help people within each agency, but also across agencies, create more solid teams and working relationships to then, of course, have better outcomes for the people in the community who use the services.
So much. Yeah, this absolutely. It's wonderful to see. And that really is the community building on a shared understanding around what it takes to really create the environments where everyone is able to flourish. And what it sounds like what you're really all doing is really working toward creating that shared understanding of what those factors and aspects are, and then communicating them with one another, which really is a win-win, not just for those folks who are in contact with the organizations, but also I think for the organizations to a great degree. So I know this was a very brief panel that kind of just hopefully inspired you all. What we will never let you go without somehow, you know, participating yourself, even over this platform. And we would love to invite you now in some breakout groups to discuss some of these questions here that I'm going to put up. So we're going to put you in a breakout group where you'll be able to answer, to discuss with one another. The first question is, what are you taking from what you heard? Even if it's, you know, just a little snippet, what is it that you're taking away from that? And then what do you plan to do in your community or in your work? So those are the two questions that we want to ask you. And we're going to put you into breakout groups, rooms of about 4 people in just a moment. And then we are going to have you stay there for about 10 minutes so that you really can have a solid conversation. And then we come back and we will discuss with one another how that works. So I am just looking at how many. Here we go. So what you have to do now is you are going to accept the button that says join this group now. And in 9 minutes, you will get a warning that says, or in 8 minutes, we're going to allow for some travel time here. You will get a warning that will tell you that you will be called back. So all you have to click is to join, and then you can come back. So we hope that you will be able to talk about, again, first, what are you taking away? And then the second question, what are you planning to do, or what do you want to do in your community? So you should receive all of the invitations, and we will see you here soon. Okay, is there anyone here who went into a room by themselves?
Is you looking here?
I am here.
Oh, I'm not even. Can you see me?
Hold on, I can't, yes, I can see you.
I am having technical difficulties. Can you try to put me back into room 15?
Yes, okay, hold on.
I can't see you, but okay. Let's try.
Yes, hang on.
Thank you.
Oh, it just said you are not joined. Hold on. I
Not,
don't.
it's like my Zoom is I'm seeing, I can't see you. And it's like I see two different back parts of Zoom. I don't know what's going on. It's got a little problem.
Okay, maybe it's because you're a co-host. Let me try. I'm taking that off.
Like I have no control. I can't stop my video or mute myself now, and I can't see.
Yeah, I cannot send you to that room again.
I think I'm going to try to leave the meeting and come back.
Okay.
Okay.
Okay. So as you are coming back, hello, welcome back. We have a few more seconds. Wonderful. All right, so welcome back, everyone. Here, our screen is populating again. That's great. Yes, woohoo. Great, so I wonder, we would love to, we have a couple minutes of time to hear back from you folks about what you talked about, what stuck out to you, and something that you might want to share. And so what you do is best unmute yourself, and if you can put your camera on, then you'll slide sort of to the top of the screen for everyone to see.
Hi, Ulrika. This is Lucy Joyce. So in our group, not everyone had seen the movie, and we'll need to somehow allow for people to be able to see the movie. I think going forward, to get a better handle on what it is we're actually talking about, it helps put it in context, I think. I mean, I'm a big fan of the movie, so very clearly, I think that would be helpful for those that haven't had the opportunity to participate in it already.
Yeah, that would be me. I was, I'm still trying to, I was a counselor for 35 years. It all sounds wonderful. I just need to know a little bit more about what it is. And it sounds like this movie is the way to go. And that very nice, what was the, Susan? Yeah, she's going to get my email, and maybe we could have a conversation. So I would appreciate that.
I've been a big advocate of ACEs for some time. And like I mentioned on the chat, you need to start with the movie Paper Tigers. Paper Tigers really gives you a preamble of what's going on with ACEs. And then the resilience is the next step. Resilience without the Paper Tigers, I don't think you get the full story. And then as we discussed in our group, the thing that we've been a tremendous advocate with at the Hillside is the solution focused brief therapy. So when you're using solution focus in conjunction with Paper Tigers, or the ACEs, I should say, and resilience, you get more of a package and try to bring out from the client you're working with through solution focus and try to understand their dilemmas with the ACEs markers.
I myself work for a Head Start program and have had the pleasure of having Ulrika be on my health advisory that I have there. And Ulrika was able to show us the movie Resilience. And then we actually brought her back to do a training with all of our staff that we work with.
Yeah, thank you. It definitely has been a wonderful tool. And I just placed the trailer for the film Paper Tigers, and I'll place the one in a moment as well. And here also Daniela mentioned that you can actually see this on Amazon Prime or rent the film on Amazon to see. Resilience, you have to have a license, and we will talk about organizing screenings for sure. Thank you for your thoughts and feedback. I'm curious what else come up for other folks.
I just want to add that in Westchester, we've shown this film probably 200 times. I've done 100 of them, 101.
Yeah.
So I know it really well. But we've developed, those of us who facilitated, put together a facilitator's guide and some frequently asked questions and things like that. So if people are interested, that's always an option too.
Thank you so much.
Yeah. And I'm going to jump in. Andy and I co-chair with the third trauma subcommittee in Westchester County. And I'm wondering if in the face of COVID, if the Westchester library system isn't offering some of those films, some of those screenings virtually. And if it would be possible for folks to jump into those groups. I don't know, Jalika, if that works for you, but it might be a sort of a quick solution if folks haven't seen it. That I too have facilitated, and it just really life-changing material for me.
Yeah, thank you. And I think really the wonderful thing that we see here today is that there are initiatives across the state, and it's important to really build initiatives that are incorporative of the local or localities, so to speak, of that unique community. And that's kind of what you have seen here in the assembly of the panelists. And so I invite you really to go to your local libraries and organizations, your local Cornell Cooperative Extensions, and build the connections and the relationships there, while we're continuing to network on the higher level here, where we can really learn from one another and so forth. So yeah, this has been really wonderful. I know that Rachel, you have one. Rachel, you'll be the last one to share, and then we'll share one more thing before you all go.
I just wanted to, in response to the library piece, I know that Grace Riario, the executive director for the Ramapo Catskill Library System, has been working with Ulika somewhat, I hope. I know she reached out about resilience, and I know they were looking at working with the libraries for the project. I'm not sure if it continued on through COVID crisis times, but I know that it was definitely something. So if you looked up the Ramapo Catskill Library System, and I jumped in because Leith was part of, I hope I'm saying your name right, it was part of my group. And so our group consisted of the College of Westchester, the Newburgh School District, and the Youth Bureau. And what we found, what was great is with the resilience is that it goes from young children all the way up through adults. And so no matter where we're all at, it's applicable and it fits. We all fortunately have seen the film and know about resilience, which is a great plug for marketing purposes. And I like what Leith had said was it gave her language for what she already knew from her years of work. So it's not like this is something completely new. It's just kind of pointing things out to us and giving us consistent language to work with people. And I'll just wrap it up. In addition to the work with the youth and the families, the College of Westchester's focus is also to help the staff recognize their own ACEs. And I think that's something was what stood out to me when I first watched the film was it's not just the young people that we work with, it's ourselves too, because we all have our own ACEs and that impacts how we work with others. Thank you.
Thank you so much. So I want to just jump quickly before here in our last 2 minutes to give you a quick overview of the sleep challenge. We told you we will not leave you without another challenge. Megan, are you still here? And
I am still here. That's right. So while we're talking about community resilience today, we still don't want to forget about our growing and building and strengthening our personal resilience. And sleep is such an important part of taking care of ourselves. It does so much to help our body function both physically and mentally. So we are offering a 5-day sleep challenge. It's really simple, really easy. You'll just get easy tips to follow to work to improve your sleep and hopefully maybe help you make a change to get a more peaceful night's rest, to wake up feeling recharged. And again, this information, don't beat yourself up if you forget about it or miss a day, whatever. You can do it at any point. We want to share the information with you. We hope you'll join us during this week of November 30th to December 4th and give us, you'll have an opportunity to provide us feedback. We hope you'll join us then, but it's not an end all be all. So it's really just we're trying to provide you tools to continue to grow your personal resilience. So we hope you'll join us. Stay tuned. You'll be hearing more from me very shortly in the coming weeks. So again, thanks for joining us today. This is wonderful.
Yeah, thank you. And so we will email you about the sleep challenge. And here is just a couple of upcoming events. We have the 23rd annual Making Healthful Decisions conference, where we will talk about tools for growing resilience over 2 days. And we will share the information for that conference with you as well via email. But just if you haven't already registered, you can do that. And I will put the link in the chat in just a moment. And then also next year, as Ginny Darling mentioned, through Cornell Cooperative Extension in Delaware County, Delaware County is organizing these trainings here all the way through May, excuse me, and you will hear about these in email and with information as to where you can register and so forth as well. And you have our contact information here one more time as well. But I do want to get off this in one more last view. And I first want to just thank all the co-organizers of this webinar series, Ginny Darling and Susie McCormick and Karen Grievous and Megan Young. They have really been an awesome team to work with and very inspiring to see what's going on. And then a special thank you to our panel today. You were awesome. And if we can all take our videos, turn our videos on one more time, and maybe also you could unmute yourself. And then, you know, we can all say a big thank you and goodbye. And we can say it if you know in any other language, you know, say bye-bye, tschüss.
Bye.
Bye.
Thank you.
Thank you.
Thank you.
Bye.